But also, I think there's a larger discussion that needs to be had in terms of what are the systemic factors that continue to enhance risk of transmission for certain groups. So short-term solutions related to the pandemic response, yes, we want to test more people, we want to link people to social support services, but the real factors that are going to change and bend that curve on a long-term scale are looking at the systemic factors that drive that. For example, testing is important. So we've got ready responders that have gone in physically to homes to test folks. That's great. And we're identifying cases quickly and isolating those people effectively. But the long-term issue is, why is it that we have seen so many instances where we've got into places where we've seen multiple families living in one-family dwellings? What's the systemic factors that are driving that, and how do we fix that change? We've encountered a lot of people. For example, we built our mobile helpline for individuals who don't have access to a primary care provider and access, whether it's their insurance status or other issues. What are the systemic factors, and what's the systemic change that needs to improve or happen to be able to increase access to health insurance and access to primary care providers and rebuild that trust within that system? So there's a whole host of systemic factors and systemic change that needs to happen that I am hopeful will continue to be a part of the conversation and supplement any of the short-term solutions that we put into place to address the public health aspects and components of this pandemic response.